I found a study done by Picciota et al. Just April of this year in 2024, where they looked at, interestingly, California wildfires and exposure to pregnant women in a large database of looking at pregnant women and preterm birth risks. And they found that if you had exposure more in the second and third trimester, smoke and hazardous air, where the 2.5 was elevated, for every 1 microgram per cubic meter where there was elevation, they found that there was an odds ratio risk of 1.01 increased risk of preterm delivery. What that means of 1.01 means that there's a 1% ratio increase in the risk of preterm birth. The average risk of preterm birth in this country is about 10%. That's just overall, but some ethnicities, like your African American, it's as high as almost 15%. They found in the study that if you had prolonged exposure, meaning weeks of air where the PM 2.5 level was elevated, then they found that there was increased risk of odds ratio of about 1.03 increased risk of preterm delivery. And what that means is that the odds ratio was increased by 3%. Now that's just the odds ratio, and that's not the same thing as probability. So if we have baseline PM of 2.5, that's 10 micrograms per meter cubed, and that goes up to 100 micrograms per meter cubed, which is the hazardous range. That means that the 1.03 odds ratio will increase from 1.03, or about 3% increase, to 1.30. Now, in terms of probability, it's not exactly the same thing. So if we convert that back to probability, if someone had a 10% baseline risk of preterm delivery with the continued constant exposure over a long period of time to hazardous air, you would see that the probability for preterm delivery go up to about 13%.